So I'm Colin Sisco, the owner here at Kaizen Physical Therapy, and we're in Seattle, Washington. And yeah, and then this is Kevin. He's kind of like sort of marketing assistant and uh, wears a bunch of hats around the clinic here and just kind of helps to like check patients in at the workshops and get them seated and does all the prep, gets all the clipboards, pens, worksheets ready, preps the room, all that. So uh, yeah.
What made you guys want to try the pelvic funnel?
So Nikki just happened to ask if we had someone that did pelvic floor, and luckily we did. And I thought, well, let's give it a shot. So it's a high demand topic, so I thought like it's at least worth trying. Um, and I don't know, based on this like first run we've done, like I'm pretty happy with it. So um, and yeah, the people that attended the workshop were happy that we were, providing like a free workshop about the topic. So.
Can you share I guess, the results of the workshop that you guys did?
Yeah, so I think we had 49 leads. We actually did an ad spend. I think it was over like 6 weeks, so longer than like a typical like 2 week or 4 week. Mostly it was just like that was the only day the PT could do the workshop, and it just happened to be like 6 weeks out. So, but yeah, 49 leads over that time period, and I think in terms of like power confirms, it was at least 50%. So maybe close to 25, and then like 20 people showed up at the workshop. And we have like officially six confirmed scheduled for evals, but like it should go up to like at least eight and then like possibly 12. So almost a 50% like conversion rate there. So like we'd be pretty happy with that. And even if it was just eight, like eight out of the you know 25 power confirms, like I'd be pretty happy with that too. So.
So these numbers compared to previous workshops or other funnels. I know you said the quality of all the leads and other funnels, but as far as power confirms attendees, how does this funnel compare to those?
I mean, yeah, Power Confirms is probably similar, but like in
Hmm.
the past before doing this workshop, like I'd say all the previous like 12 months before this, yeah, we'd get a lot of Power Confirms. So like Kevin here he'd do all the quick confirms and the Power Confirms, and then people just wouldn't show like at all. And then
Yeah.
we'd try to reach out to them a bunch of times and like no response. Um, so yeah, that was kind of tough. And then like even the people that did show or that were interested, like they had basically a state Medicaid insurance that we're just like we're never going to take. Like there's just
Yeah.
no way that'll ever happen. And so we just had a lot of like state Medicaid people. So it was like the quality of people that had a good insurance that we would accept. It was like one or none.
Hmm. So
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 then
comparative, these leads seem to be better then.
higher quality, better insurance type, um, and at least more responsive.
There were other similar practices that were considering doing pelvic floor just from what you guys have tried, because you guys have been with us for a while. Um, would you recommend another practice who has a pelvic floor therapist try the pelvic floor funnel?
I definitely would. I think the response will be really good, like regardless of where it is in the country. And so, um, yeah, I mean, Seattle is a pretty dense area, and can't be the only ones like advertising. There's a lot of pelvic floor PTs here, but they're usually like cash only. They don't take insurance, but I know they have their own ads out there, and so I feel like over 6 weeks, getting like 49 leads, like that was pretty good.
Mhm.
Um, I thought maybe we would get like in the 20s, but like to get like 49, I was pretty happy with. So yeah, other practice should give it a try for sure. I mean, yeah, I mean, I would try it like at least two times and see how it goes. But it's a high demand topic. Some people don't know who to reach out to.
Mhm.
There aren't sometimes that many PTs that specialize in it, so it can be difficult to like find that person.
Yep.
Um, so yeah, I just think it's a high demand topic all over the place.
Appreciate your time, and yeah, I'm looking forward to more results for you guys.
Awesome. Thanks, Gene.
All right, have a great day.
All right, you too. All right,
All
bye.
right, bye bye.